developing several tools, and one of them, I would say the most important one, the key one, is of course the FHIR Station that will allow healthcare organizations to manage and to really have a view on the data exchange and the new ways to do the data exchange and the FHIR communications that will be required in today and in the near future and in the far future. And you can go to the next slide, please. As we mentioned, we have all the different users of information for the primary use, the direct care for the patient. We didn't talk too much about it, but also to the whole ecosystems of AI, of dealing with data of patients in general. We want to be able to control, of course, which data we deliver there and which level of security and privacy and so on that we want to put on that. There is the operational use to do benchmarking and so on. And of course, as we mentioned, clinical trials, the secondary use, the research, those are all consumers of data on the one side. And then on the other side, we have the data itself. We move to the next slide, where we have all kinds of sources of information. Could be the EMR, could be the HIS system, could be information coming from home care, specific devices that are, because we are now more and more doing a follow-up of the patient at home, where we are also generating results. Patients have their own devices, enter information in their smartphones, or have access to certain, or to provide access to certain information in smartphones or smartwatches and so on. So there are all kinds of data, I would say, repositories. That's the way we refer to it. If we talk about the FHIR world, there will be so many repositories or information that we will need to have under control, and we want to make sure that if we want to expose that information, that we have a good control on it and a good level of management to make sure we do it in the right way. And then if we move to the next slide, we are putting in the midst, I would say, in the middle of on the one side, the requesters on information, and on the other side, all the sources of healthcare data that we will have today and will have many more in the future. We will put a layer, what is called FHIR Station, maybe one back.
Sorry, yeah. Sorry, my fault. Okay.
Yes, FHIR Station, which will allow the governance organization or the IT organization, depending on which type of healthcare provider or organization you are, to have control on the exchange of that data, to be able to control all the FHIR requests that are coming in, and to be able to put rules on which data can be accessed and in which way it will be exposed to the requesters of data. In some cases, you will need de-identification or pseudonymization if you talk to an AI algorithm, for instance, or you want de-identification if you want to send it for a clinical trial. If you have a strong governance in your organization to allow certain projects to have access to information, there's a whole governance workflow also included, and which is quite important, will be the logging and auditing on every event, on every piece of information that will be exposed to an external party. Because one of the requirements also in HDS is that a patient will at any time will have the ability to request, to whom did you expose my information, or they even can ask to a healthcare organization to stop exposing certain information. So with FHIR Station, we want to really provide the tools to the healthcare organization to take control and to really have a view on all that, on all those data exchange requests and all those data access points, to make sure that you have the hands, that you have your own management in your hands. And data can be also inserted through the same FHIR Station. You could have legacy systems that still spit out HL7v2, or even could be CSV, comma separated data sets. We can also store that information into a repository and make sure that it's curated and really it has a high level of integrity, so you are not I would say, spoiling or turning your repository of information into garbage. So you have a good control of all the information that is in there, and you don't do endless duplication of patient data. So this is our, I would say, one of our answers towards taking control and being sure that you're able to respond to the more and more increasing level of data requests and data exchange requests that we will have today and in the future.
And the best way to share with you how your healthcare organization can benefit from this solution from FHIR Station, I think it's to share a real use case. And we prepare it also for you. So let's see, because we have few minutes before, actually we have 10 minutes, but I would like maybe briefly just to share the use case, because it's quite impressive results that you achieved.
Okay. Maybe go to the next slide with the real worst.
Yeah.
It's called COSO. Maybe a little bit of background information. COSO is it's actually a regional network. It's a regional data exchange network, pretty much based on a very local API format, but the participation is massive. We have more than 37 hospitals that are being part of that, nursing homes, laboratories, and so on. So there are more than 190 healthcare organizations, small and bigger, that are really connected to the COSO network. It's an app, it's an application that shows you the medical information, but it's also a backend data exchange platform that allows you to pull in the data as well. If you look at the usage of the COSO regional network providing that data, we have more than 1 million unique caregivers and patients that are really consulting the data. There are 4.5 million of requests per month, and okay, the money it saves per year, I don't think we need to go into these details. These are, of course, certain calculations and impressions, but the fact is that the data really remains at the source. I think that's an important aspect of this network. And yeah, you can basically, in Belgium, you can pull up wherever the patient arrives. You can pull up through this network. It's a meta hub kind of infrastructure, and you can pull up almost any result from a patient, no matter with which GP or no matter in which hospital you end up, of course, also taking into account the patient consent. So for this regional network, we can go on to the next slide. We have within this regional network project, we have a small new future project which is called Shift. And it's a FHIR, it's a completely FHIR-oriented project. And as I mentioned, currently it's running on a very local data format with a local SOAP for the technical people, SOAP interface, which is you need VPNs. It's less secure and so on than the way FHIR and all the REST services have been designed. But actually, we have now 5 hospitals chosen from within the network that will start exchanging allergy information and historic problem information about the patient in real time. So the purpose is really to use the new data exchange format within the regional network. Yeah, you can go to the next slide. Yes, so it's quite ambitious because, as mentioned previously, and the most of the data exchanges that are happening are text-based, but in this case, we really want to make sure that we can have access, because FHIR is designed for that, to have access to the structured data. So one of the challenges and the hurdles they need they needed to work on is to actually snowmedize all the allergy information and so on, and get in every hospital agree on, you know, which codes to use and so on. I think many people working at healthcare providers will understand what I'm talking about. It's not so easy, of course, to get everybody on the same page, for certain codes to use and so on, because SNOMED it's a very broad terminology. But it was also very ambitious around the integration, because every hospital had its own EMR. The whole interaction is also based on the FHIR data sets that have been defined on a national level. They were not all finished yet, but you know, today we can say that this project is now live and running and are using the data sets and the care sets that have been defined within FHIR by the Belgian healthcare agency. The good thing is, I think it's a distributed FHIR architecture, so still all the data remains in every hospital, so every hospital can decide upon themselves which data they want to make available, which security they want to apply to it, so every hospital keeps the control on their data. So yeah, I think certainly the people are very enthusiastic within that project, and it's really live as we speak, and it's, you know, really running on the new HDS stipulations and regulations, if you will, because we're exactly using the same data formats and the same data technology that is being specified within the HDS regulation.
It's a perfect example of how actually healthcare organization can move and make this digital transformation and shift and enhance the exchange of the data in the different dimensions. My question is, let's imagine there is a hospital in Spain that wants to achieve the same results. What they should do in this case?
Yeah,
I think it's actually a question to both of us.
Yes,
So
talk to us. I would say talk to us, and we can try to understand their situation, and you know, they can make use of our knowledge and expertise that we both have in this domain, of course. Yeah.